चलो ये अपडेट शुरू हो गया। फिर कंप्यूटर पे अपडेट
कैसे किया हो?
पता है।
उससे भी किया हो?
हाँ वो पूछता है पहले।
हाँ? ठीक है।
हाँ, ठीक है। अच्छा
म्यूट
Good morning, everybody.
Good
Good
morning.
morning,
Dr.
sir. How
Sudhir.
are you?
Good morning, Dr. Sudhir. How are you?
Oh, fine, thank you. Thank you very much.
आप दो रहे हैं
एक हाँ
आप देखिए
मेरी
किसी की बात
सब में चेंजेस करके नया वेरिएंट आपको आपको मुझे फॉरवर्ड कर दिया उसको नहीं ईमेल पे आपको
ईमेल पे इधर है आपको भी आया होगा या फिर
ये तो देखिए मैंने आपको बंदा दिया कि नहीं
हाँ वो भी ऑफिस में
बस उसे क्या
पूछेगा
आपने बंदा नहीं पता मेरा पता है उसको
वो भी लगता है और तब कहते हैं मुझे बता दो
ठीक है
ठीक है तो ऐसा हो इंडिया में
Distinguished speakers, dear colleagues and participants, a very good morning to you from ComSats. On behalf of the Commission on Science and Technology for Sustainable Development in the South, I, Dr. Azima Farid, Additional Director, Health, in charge Telehealth, welcome and thank you all for joining in this webinar on Health for All through digitally enabled efficient health systems. This is the third webinar of the series on digital health by ComSats, focusing on the ComSats member states of Middle Eastern and Central Asian region. Previously, we have covered South Asian and African. Over the past few decades, digital technologies have become pervasive in all areas of life, including healthcare. The COVID-19 pandemic has accelerated the adoption and focus of technology and innovation in healthcare, transforming the way we approach disease diagnosis, detection, triage, virtual care, remote monitoring, and training. As healthcare becomes more decentralized and digitalized, it is essential for stakeholders, policymakers, and governments in developing countries to keep up with these advancements. In 2020, the World Health Organization's member states adopted a 5-year global strategy on digital health, which aims to promote collaboration and knowledge sharing in this field. As an intergovernmental organization of 27 developing countries, ComSats recognizes the need for proactive collaboration and knowledge exchange among its member countries to promote digital health and its benefits. Management of increasing prevalence of chronic diseases, high incidence of infectious diseases, large number of migrants due to conflict, insufficient human resource are some of the reasons that call for urgent measures to digitalize health systems in developing countries. Digital health solutions such as telemedicine, remote patient monitoring, disease tracking, better management, data management would enable the policymakers in these countries to fill in the gaps of the health systems. Today's webinar brings together colleagues from countries like Jordan, Syria, Iran, Palestine, and relevant organizations to share their innovations and development in digital health. They will be discussing the digital health scenario in their respective countries or regions, along with the colleagues challenges being faced or the lessons that we can learn from their experiences. We look forward to hearing from our distinguished speakers who will take us one step closer to empowering health systems through digitalization. Ladies and gentlemen, I would like to invite Executive Director ComSats, Ambassador Dr. Mohammad Nafis Zakaria, for his welcome remarks in this event. Mr. Zakaria is an illustrious career diplomat who has represented Pakistan as High Commissioner to the UK and Malaysia. Throughout his career, he has held important positions in London and Toronto High Commissions, as well as various diplomatic assignments in Abu Dhabi, Jakarta, Bangkok. He was also Pakistan's representative to UNESCAP Bangkok. At the Ministry of Foreign Affairs in Islamabad, he had important senior positions, including Additional Foreign Secretary, Spokesperson, Director General for South Asia and SAARC, and Director General for Europe. Most recently, after his retirement from foreign services, he has been appointed by the President of Islamic Republic of Pakistan as member Federal Public Service Commission of Pakistan before joining ComSats in November 2022. Distinguished Foreman Christian College, a chartered University of Pakistan, has awarded an honorary degree of PhD to Dr. Zakaria in recognition of his services to the people at home and abroad. Sir, please.
Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Azima. Distinguished speakers, worthy participants, ladies and gentlemen, Assalamu alaikum and good morning. I'm very happy to see such participation at this webinar. On behalf of ComSats Secretariat, I welcome you all to this webinar on health for all through digitally enabled efficient health systems in Middle East and Central Asia. Given the current health challenges that we face globally, the topic of today's discussion is a prudent choice, being very relevant. The COVID-19 pandemic was a clarion call to highlight the significance of efficient, accessible, and more importantly, tech-enabled healthcare systems and need for adoption of digital technologies that played a crucial role in the wake of the pandemic to that end. We have witnessed during the pandemic that the digital technologies have been instrumental inter alia in supporting the delivery of healthcare services, enabling remote consultations, and facilitating the monitoring of patients' health status. Digital technologies have also enabled the efficient management of healthcare system, including the allocation of resources and tracking of disease outbreaks. Ladies and gentlemen, the integration of digital health into health system has a potential to revolutionize healthcare delivery by improving access to quality healthcare services at reduced costs. The use of EHR, electronic health records, for example, allows healthcare providers to share patient data across different healthcare settings, which can improve care coordination and enhance accurate diagnostics and treatment. In this particular context about the data that we gather, there are many other benefits of utilization of this data from the point of view of precision medicine and also use of data for other purposes. As you know that AI intervention in this field has actually made a huge difference. Telemedicine trend is fast on rise, which helps provide medical care to people in remote and far-flung rural areas. It is helping developing countries in improving their national health indices. At this juncture, I'll cite a famous proverb which goes well with the topic of today's webinar: a healthy nation is a wealthy nation. COMSETS, an intergovernmental organization committed to utilization of scientific and technological advancements for the socio-economic uplift of the developing countries, has successfully showcased the potential of digital health through initially pilot projects that we ran. These projects evinced interest of the government of Pakistan for establishment of telehealth clinics across Pakistan in rural areas. The doctors and specialists at COMSETS Telehealth Resource Center in Islamabad are able to treat minor illnesses and could also help treat the major ones, providing valuable online healthcare services to the communities in the far-flung areas of the country. COMSET's other members should also benefit from this expertise. As an organization of 27 member states, COMSETS aims to promote South-South cooperation in science and technology through its 24 centers of excellence. Since its founding in 1994, COMSETS has contributed to sustainable development in the South at both regional and sub-regional levels. The organization continues to align its activities with the UN SDGs and is committed to developing synergies with governments in the South and beyond. We believe that the health systems of the developing countries have similar challenges like inadequate infrastructure and human resource, limited access to primary care, and poor health literacy. Collective efforts and shared expertise with each other could help build better health systems that are able to fulfill the health for all vision. COMSETS has been advocating for the propagation of benefits of digital advancements in health. Since 2020, in a series of regional webinars for the South Asian and African member states, COMSETS has facilitated interaction among and with experts to share, as we do it today, their experiences, tech-enabled healthcare. The experts highlighted the previous events, the potential for applications of IT in healthcare, challenges, and required policy interventions for adapting tech-enabled health services were also discussed during those events. These advocacy activities bring together individuals, organizations, and public officials at a common platform to address and achieve common causes. Today, we have gathered for the third webinar of the series to bring digital health stakeholders from Middle Eastern and Central Asian member states of COMSETS. The experts are envisaged to showcase successful digital health initiatives, their impact on health, and discuss implementation of IT-based solutions. Ladies and gentlemen, the webinar also marks the World Health Day 2023, celebrated on 7th April every year. This year, theme was Health for All. COMSETS believe in adapting to the new approaches by the Global South to address the healthcare-related challenges posed by the pandemics and many other causes and convert them to the opportunities as we did during the COVID-19, or in the wake of COVID-19 pandemic. The developing countries need to collaborate through joint publications on indigenous researches, policy and strategy sharing at governments and institutional levels, trainings and capacity building for the application of digital technologies for health. In conclusion, ladies and gentlemen, I would like to reiterate my appreciation for the organizers of this webinar in bringing together experts from across the regions to discuss how digital technologies can be leveraged to advance health for all. I would also like to express my gratitude to the speakers and the participants for their commitment to advancing health for all through digital-enabled, efficient health systems. I believe that by working together, we can leverage the power of digital technologies to transform healthcare delivery, improve health outcomes, and ensure that no one is left behind. I sincerely hope that the discussions today will generate valuable insights and ideas that can be translated into concrete actions to strengthen healthcare systems in Middle East and Central Asia, as also across other member states of COMSETS. Thank you very much.
Thank you, sir. I hope that your leadership will give COMSETS Telehealth's new dimensions and new avenues. With your permission, sir, I would now like to proceed to the technical session of the event. From here onwards, the session will be moderated by Dr. Najib Al-Shobaji, an eminent name in e-health and digital health. Dr. Najib Al-Shobaji is from Jordan. He has been working as a volunteer and consultant in e-health, knowledge management, and medical librarianship since March 2017. Previously, he has served as Director of Knowledge, Ethics and Research Department at the World Health Organization, WHO, and worked as Coordinator for Knowledge Management and Sharing, Regional Advisor for Health and Information and Telecommunication, Information Scientist at WHO Regional Office in Amman, Alexandria, and Cairo. Dr. Najib holds a PhD in Information Science from UK. Dr. Al-Shobaji has held high positions in various national, regional, and international scientific and informatics associations and committees, including the president of the Jordan E-Health Development Association. He is also the editor and peer reviewer of several specialized scientific journals. Dr. Najib, the floor is yours.
Thank you very much indeed, and for the great words that were said by the President and by yourself on introducing myself and the use of digital health has been really nicely and fluently and most eloquently introduced, and it's my pleasure to be part of this as a moderator of the technical session, and I have full trust in the ICT, information and communication technology. Of course, the parts that relate to the confidentiality, the privacy, and the spread of the technology in rural areas in particular are among the challenges. And we have a number of speakers actually who will shed light on the development and the challenges that are faced in these countries. As has been said, the idea is that we learn from each other. We can capitalize on what has been achieved, and hopefully the countries themselves will actually replicate or will understand the different challenges and try to avoid them or try to solve some of these issues. As has been said, the potential is great of the digital health strategy, or e-health as it has been used to call, or different people like to call it this way. Of course, the different speakers will highlight the different aspects of that. My first speaker is a friend of mine actually, and I'm really pleased, and it's a great pleasure and honor to introduce him, Dr. Vajiro Vajira Desanyanki. He is the chair of the Commonwealth Center for Digital Health, and he is a medical doctor with vast experience in digital health. And I can certify that. And in fact, a few years back, I did meet him in Colombo, in Sri Lanka. There was a meeting there, and it was a great honor actually to see him. Dr. Vajira is actually a member of WHO Digital Health Guidelines Development Committee and a member of the roster of experts in digital health at the World Health Organization. And he has a number of other achievements. Of course, his international reputation is something that we all feel proud of. At the national level and at the regional level, he did establish the master's degree program in health informatics at the Colombo University. And he is the current president of the Sri Lankan Medical Council. So his expertise actually go beyond medicine, and his love to telemedicine and digital health are also very much distinguished. It's my pleasure. It's really a pleasure to introduce Dr. Vajira to say his to contribute to this, and the experience that has been in Sri Lanka is one of the most distinguished parts in digital health at the global level, and that actually has given Dr. Vajira and his colleagues a huge space in digital health globally. So without further ado, Dr. Vajira, the floor is yours. I think you have 15 minutes. Please go ahead and present.
Thank you very much. Thank you very much, Chair, for those kind words of introduction. It's very good to see you after a while, Najib. Thank you very much. Ambassador, as the Executive Director, Ambassador Zakaria, Dr. Farid, thank you very much once again for the invitation to talk at one of your virtual webinars. It's indeed a pleasure to be here and to contribute. Dr. Najib, I will not be talking about Sri Lanka today. I'll be talking about what we've been doing at the Commonwealth level and sharing with you some ideas from that would, I think, inform today's deliberations and discussions. So I would like to keep this very simple and at a very high level of discussion, and to tell you the kind of thoughts that we are now taking forward at Commonwealth level that may be relevant not only to the countries which are part of the Commonwealth, but beyond. And I'd be happy to, at the outset, invite other countries also who would be wanting to become a part of what we are doing, to please reach out so that we can all, go on this journey together, because the digital health journey is one where we all have to collaborate with each other, and there is a lot that all of us can learn from each other. I'm sure that all of you would agree with me when I say digital health solutions are tools that should be used to strengthen health systems. At Commonwealth level, we look at health systems in the form of what we call a systems framework for healthy policy. And when in this framework, we've got what we call the enablers, the governance, advocacy, knowledge, capacity, and so on, the enablers. And as Najib said, one of the strengths that we've got in Sri Lanka in terms of digital health is the capacity development that we have done. And that is what really I've been trying to promote in the Commonwealth as well, through the Commonwealth Center for Digital Health. In the middle, we have the key services, which are aimed as promotion, protection, prevention, and of course, with the people who receive our services in mind. So when we at Commonwealth level have tried to map the various digital health solutions that are out there, we find that these solutions can be mapped into this framework. And I'd like to invite you to take a look at this platform for planet, place, and people that we have created, where you can look at the various digital tools coming from across the world that we have evaluated and mapped into the health systems framework. It is so very important for us as we go on to do that, because when we talk with governments and advise them which tools to be used and for what purpose, it is important for us to have that healthy systems framework in mind. I'm going to take you back to a couple of years ago when the Commonwealth, what we call the civil society, met together in our annual policy forum. We have a Commonwealth Civil Society Policy Forum, which we convene every year. And in this forum, a couple of years ago, as we were going into the pandemic, we deliberated on digital health with a focus on health, strengthening health systems, with the focus again also on ensuring universal health coverage. Now, in this forum, what we do is we bring together all stakeholders, not only doctors, but nurses, midwives, pharmacists, social workers, everyone who is in the sphere of healthcare, and deliberate on how we use technology. And not only technology, but other areas of healthcare as well. And in this particular year, a couple of years ago, we dwelt on technology, digital technologies. And what we do following these deliberations is that we come up with what we call a policy brief, which we take to the Commonwealth health ministers who meet every year. And we advocate as to what has to be done. And the policy brief that we came up with a couple of years ago, which is on our website, if you are interested in looking at, focused on advocating with the ministers at their annual meeting the potential benefits and of digital solutions. And you can see them listed here, and I'm sure all of you would agree that these are the reasons why we are advocating for adoption of digital health as tools to strengthen health systems. At the same time, we also know that there are challenges that we face. And without the interventions of governments, the interventions of international agencies such as the WHO, the international agencies that set standards in the sphere of healthcare and digital technologies and ICT, like the ITU, we cannot go forward. So therefore, we need to have that intergovernmental engagement at that highest level to go forward. So we were that year successful in our advocacy with the Commonwealth Health Ministers mandating that some action has to happen in the sphere of digital health. So from the statement that came out that year, these are two clear messages that the health ministers gave the Commonwealth Secretariat. And with that, it led to the establishment of what we call a digital health work stream in the Commonwealth Secretariat, which is chaired by the Health Minister of India and the Commonwealth Center for Digital Health as well as the Commonwealth, as well as the World Health Organization are the two main technical advisors to it. We've developed a roadmap on how we go forward. But when we started discussing the roadmap, we realized that we need to provide technical support to countries. So we developed a country technical support program for enhancing digital health maturity. And currently, these countries listed on the slide are on board with us, working with us jointly to move forward to receive support as well as enable digital solutions. Now, most of you in this meeting today would be familiar with the digital health building blocks in the WHO ITU strategic document that is there. And when we have discussions with countries on strategy and investments, services and applications, standards and interoperability, infrastructure, then legislation, policy and compliances, and workforce, we find that there are major gaps. There are major gaps in all of these areas. And one of the glaring deficiencies that we find is the gap in workforce, the workforce that is required to enable digital technologies in their countries, especially leadership within the health ministries with people competent in both the health domain and the ICT domain, who can spearhead integration of digital technologies into the health sector. And that is a real challenge that everybody faces. I wanted to highlight that at the beginning. But going forward, to work with countries, to help them go to higher levels of maturity, what we did working with the WHO was develop a customized tool specific for the specific context of the Commonwealth, which we called CWCDH MAT, of which we have version 1, the Commonwealth Digital Health Maturity Tool version 1, where we are looking at all of those pillars in different ways. So some of the domains that we are looking at are on this slide in the sphere of governance. So in the main domain of governance, some of the areas that we are looking at are listed here. Then in the next slide as well, and then in the other domains, I'm just taking you through these domains. You will also see the areas that we are, looking at and trying to help the countries going forward. So it is so very important for us to continue to provide that support, so that as various health ministries, health systems try to, implement digital health solutions and try to work with strategy, work on, service and applications, work on standards and interoperability, and build infrastructure, there is support that is available for them. Because, as I said, the indigenous support is not there. So in conclusion, as I come to the last minute of my talk, as I said, the Commonwealth, through our country technical support program, is committed to supporting countries to enhance their digital health maturity. And we, as I said, have partnered with the WHO in this process, as well as it's strongly led by the Commonwealth Secretariat. The Secretariat has intergovernmental, connections with more than 56 governments across the world. And we are strongly backed by a ministerial mandate coming from the Commonwealth Health Ministers. And therefore, going forward, we would like to open up our services, the work that we do, and the engagement to countries that are outside of the Commonwealth as well. And I see in this meeting, there are a lot of those countries which are outside of the Commonwealth, and we'll be happy to work with all of you. And I'll be happy to take any questions or answer as we go forward. And I would invite all of you to please feel free to reach out to us and to engage the work that we are doing. So with those words, I would like to thank you very much, say thank you very much to the Ambassador and Dr. Farid, as well as our chair, Dr. Najib, for the invitation to speak this morning. It's indeed a pleasure for me to have shared these ideas with you. Thank you very much.
Thank you. Thank you very much indeed, Dr. Vajira. I think that is very comprehensive and very nice overview of what you have done in the Commonwealth in terms of digital health or e-health. Thank you so much. Maybe we can leave the questions until the end, and I trust that you will continue to be with us at this point. And although you spent about 14 minutes, not more than, so you have been very strict in terms of respecting the time. So thank you so much. The highlight of what has been actually is actually to develop plans in these countries and to develop human resources and to have the policy brief and to have the digital health tool. These are the cornerstones of what can be done. Of course, the idea to have infrastructure and to have human resources to manage this undertaking is actually important. So thank you so much, Dr. Vajira, and we look forward to the next phase of actually interaction with you in terms of asking certain questions. Now, it's my pleasure to introduce Dr. Severo Pellizi from WHO Representative Office in Jordan. Dr. Severo is actually a medical epidemiologist with more than 15 years of experience in global health at country and regional level. He has been working in the WHO Eastern Mediterranean region, in particular, including, of course, Jordan. He is actually the lead of the country team on emergency in Jordan office, and he has been leading the COVID-19 response as well as migrant and refugees health agenda. Dr. Severo is actually the expert in emergency response that WHO is actually leading, and I'm sure he will be focusing on how can digital health be used to respond to emergencies in countries, including Jordan. So with these, I will. It's my pleasure to introduce to have Dr. Severo to speak for the coming 15 minutes and to listen to his own experience in the region and in particular in Jordan for emergency team that he has been leading and the use of digital health. Dr. Severo.
Dr. Najib, ladies and gentlemen, thank you so much. It's an honor to be here with you all today. And as you rightly said, I'm the emergency team lead for the Jordan country office of the World Health Organization. But I have to thank my colleagues on the health information, stream work here in Jordan, Dr. Nover Ansari, that is supported by Dr. Najib, of course, and also the regional office under the leadership of Dr. Arash Rashidian, to really inputting different important elements to this presentation and my intervention today. In fact, I would like really to, in a nutshell, to give a few important messages on digital health in the Eastern Mediterranean region and how the emergency, and in particular COVID-19, acted as an accelerator for that, and how it is important right now from the emergency point of view, and a really short snapshot of the situation in Jordan. Now, why digital health? In the previous, introductory speech, you eloquently already mentioned different aspects, but all these aspects are already very much, related to what happened during COVID-19, and it will be more and more. Essential health services were a clear, a pillar of the COVID-19 preparedness and response plan. So telemedicine is very much the future that is going to complement the traditional way to work in the provision of clinical work. Telediagnosis, a very good example from eye care and diabetics, enhance access to maternal and child health for remote or rural population. And again, this is very much, important in countries in the Eastern Mediterranean region because of the migrants and refugees. Now, it's also very, very important to allow the connection of the different systems existing in the countries, because a reality is the, fragmentation of health systems. And of course, the final target is really to respond to the people's expectations and to provide people-centered care. Now, very quickly, you already highlighted how the WHO member states unanimously adopted a resolution in 2018 in support of digital health. And this resulted in the Global Strategy for Digital Health 2025, which was endorsed in the 73rd World Health Assembly in 2020. And this is just to give you the message that the importance of digital health was already pre-COVID-19. So there was already a kind of an understanding of the importance of this. And as I was saying, COVID-19 acted as an accelerator. In fact, if you look at the WHO regional survey in 2021-2022, there were already the application of different health technologies in different countries with regards to different aspects of, supporting the health system. In fact, at that time, 15 countries were already using health technologies for vaccine administration, telemedicine in 8 countries, diagnostic application in 6, as well as for digital contact tracing. Up to the hospital bed dashboard. A very good example was during COVID-19 here in Jordan. Now, in the previous presentation, some aspects were already highlighted in terms of identified challenges that should be really the focus on the development of strategies and plans in all countries. Of course, funding, infrastructure investments, and this was again within surveys conducted in the region, expertise in 7 countries, software, culture, also the acceptance by the population and health workers, planning up to language, again, in specific countries with high percentage and high volume of migrants and refugees. It's important also to think about, the language and also other systemic barriers. Now, following, the global strategy, of course, the WHO, the regional office based in Cairo, adopted the digital health strategy in the Eastern Mediterranean region, 2023-2027, with, clear actions in alignment with the country health priorities, trying to enhance the collaboration with multilateral stakeholders, and really with a clear orientation on sustainable financing and monitoring the digital maturity level. Strategic objectives of this regional strategy, of course, are about governance, so norms and standards, evidence generation mechanisms, digital health strategy, so situational analysis and digital health architecture, and this is what happened in Jordan, and I will get back to you on this in a few minutes. Then priority for actions, clear priority for actions, again with a target of people-centered health systems. And again, as in many different strategies of WHO at regional and global level, it's a very good occasion to strengthen collaboration, because partnership, as evidenced in COVID-19, is a clear, enabling factor to advance on health system, as well as also in other important aspects. Now, the same strategies assuming the national stakeholder engagement by countries with investment in plans and architecture, capacity in digital health, and interoperable national digital health systems. Now, if you look at another survey done again by WHO, when specific aspects related to the existence of strategy and plans around national digital strategies, this was the evidence at the time. You all know that the Eastern Mediterranean region stretches from North Africa up to Pakistan. So that's why I tried to highlight with blue arrows beside each country which one belongs to the Middle East, just to give, to contextualize a little bit on the really Middle East region. And you see that was a really variegate situation, with some countries like Iran in the 21-22 having in process or already in place a strategy, and like also UAE, so United Arab Emirates, but some other countries with the strategy in process, like Kuwait, Lebanon, some other countries with no strategy at the time, but a really active engagement on this, like Jordan right now. And again, thanks to our health information stream work supported by Dr. Najib. These again different aspects that were highlighted in the same survey, with health technology used for in different areas of the health system. And you see that telemedicine was one of the most used, as well as electronic medical records and others. Now, let me link the very first line in this slide with the emergency work. Emergency work, of course, COVID-19 was a kind of ring bell. Emergency cycle management that goes from prevention to preparedness, response, and recovery is very much now core work of WHO and the global level health, priorities. And surveillance, in particular, is extremely important and critically, fundamentally important in the prevention and preparedness at country, regional, and the global level. And again, the importance of surveillance in capturing the right, accurate, disaggregated information is very critical part of health information and digital health technology. This was evidenced during COVID-19 in the intra-action reviews at country level in many countries of the world, including Jordan. And that's why this is the focus, this must be the focus, to have proper decision-making based on disaggregated data. What happened in Jordan? Jordan, as you saw in 2021, 2022, there was not yet a strategy, but it was already some kind of preparatory work really to enact consultation under the leadership of the Minister of Health. And so that's why situational analysis was enacted. And this situation analysis was extremely important really to fit into the preparation of the strategy that is ongoing. And in a nutshell, these are the key points that really originated from this situation analysis. fragmentation of different health systems that is quite, I would say, almost normal in all countries of the world. Sometimes a lack of interoperability, but also aspects that were highlighted in the previous presentation, like the needs of training, education, financial resources, as well as, of course, research in health informatics that will, feed into more and more evidence and a better, health digital technology that can be also, for instance, in emergency work, really in support of, for instance, integrated disease surveillance. So that's where we are. Our health information officer, Novera, is incredibly working on these aspects, very much commitment by the Ministry of Health and by WHO. And this is very important because we are in the process of, really supporting this national strategy and action plan 2023-2027. And the vision is better health for all people in Jordan using appropriate digital health solution, while the mission is to establish and support an ecosystem that enables the adoption of appropriate interoperable digital health solutions for introducing high-quality health services for all people with no financial hardship. And I will never stop really emphasizing the importance of these aspects in the connection with the universal health coverage, but especially with focus on primary health care, which is the interface for health security right now at global, regional, and national level. I'm not going to go into depth in this slide that really illustrates the incredible work again of health information here in Jordan from the different health system and try to bring together the different health sector actors in streamlining policies, indicators, and SOPs. It is really all the work that is going to converge in a possible unique platform for proper decision makers at higher level. Many thanks for your presence, and of course, digital health is expanding in all countries. There is a huge potential, and there is commitment. So there is a momentum on that. We need to continue to work on that. Many thanks again, and over to you.
Thank you very much indeed, Dr. Saviro, and for the overall picture that you have highlighted. From global activities to regional to the country, with focus on what is actually being implemented and worked on in Jordan, specifically with the work that the country office is actually spearheading, and the Ministry of Health in particular in the area of digital health. So thank you so much indeed, and thank you again for the overall overview. And I trust that you will continue to be with us until the end, because we probably have some questions from the audience, and I will probably ask you a few questions. So thank you so much for all the words that you have given, and for the highlighting the work of the regional office and the country office in the area of health information management, including, of course, digital health, or e-health, and the rest of it. Thank you so much. Now, it's my pleasure to introduce Dr. Husna Salmani. I know Dr. Husna from communication only, and she is actually a PhD student in the health information management at the Iran University of Medical Sciences in Tehran, Iran. And she has experience in health IT, including information management in health, mobile health, patient-centered care, Internet of Things, cancer registry, and virtual education, including e-learning, and a number of other things that are related to digital health. Dr. Husna Salmani has been awarded different awards in different centers, including the National Elite Foundation the Gifted and Talented Student Center of Tehran, and was chosen as a winner of the Youth and Technology and Health scholarship. So she is actually in that particular area of e-health, and probably she is a practitioner in e-health, and Iran is one of the countries that are very much distinguished in the health and digital health in particular. I know that from previous experience that they have done a lot in that area. Dr. Husna is actually a member of the health committee of the Healthcare Information Management System Society. So she has actually she has been elected as part of that, which are the most distinguished parts of what she has done. With all that, it's my pleasure, in fact, to welcome Dr. Husna to the next speech. She will give an overview of what is actually happening and what might happen in Iran in terms of digital health. Dr. Husna, the floor is yours.
Hello, everybody. Thank you so much for your invitation. It's my pleasure that I'm here to talk about the implementation of digital solution in the healthcare system, specifically in Iran. I will share my presentation on the screen. So go. I don't know. Okay, you may know.
Yes, indeed. We can hear you very well, and the presentation as well.
Thank you so much. Okay, what I want to talk about is a little bit about digital health and electronic health record, Iranian health electronic health record system, which is CEPAS in Iran, a feature and requirement, project success, failure and opportunity and summary, and also recommendation for the future. Everybody knows that EHR are a secure records that can be shared by using a standard, and because of the electronic exchange that we have and interoperability standards like ISO between different organization and units, and also it can be created by the system that we can call EHR system. According to the National Alliance for Health Information Technology, EHR is an electronic record of health-related information of an individual that conform to nationally recognized interoperability standards and can be created, managed, evaluated, consulted by authorized clinician and staff across more than one healthcare organization, because we have the flow for the EMR, EHR, and EHR can be shared by more than one organization. EHR is considered the output of electronic health record system, and this system can be defined as the set of components that can form the mechanism by which that EHR can be created, used, edited, amended, stored, or retrieved, including people, data, rules, human resources, procedure, processing, storage devices, software, and hardware, communication and support facilities. About CEPAS that I talk to you, CEPAS is the project that was performed by Ministry of Health and is one of the biggest national electronic health record project, and that with the aim of building a nationally integrated EHR for every Iranian citizen. And it can follow the triple purpose for healthy citizen, also inform government, enable also researcher. And nowadays, after also 10 years, we can see that Iran has moved from a starting point to use the EHR to coverage with 90% for Iranian citizens. And as I talked to you before, SEPAS is Iranian electronic health ecosystem, and organization is Office for Statistics and Information Technology in Ministry of Health. And this is the website, and this is the governmental, and from 2007 up to now. And the phases of this project, it formed in 2001, and because of I can say that this is the notion of electronic health. And in the first phase, it was study and recognition, and that investigating a common health application in the country, checking top experiences and the international standards. In the phase 2, we have architecture. In 2008 up to 2009, it was selection of the technology and focus on security and development of a reference model. And from 2009 up to present, we had phase 3 for development and deployment. We had the design software in more than 46 University of Medical Sciences. And this is also but this is a remarkable point that we couldn't have the national information network, because maybe we couldn't achieve this exchange between all the hospitals in Iran. SEPAS is a national electronic health record for Iranian citizens that can collect patient data from all hospitals in a centralized system, which is now the database in the Ministry of Health. And SEPAS project is designed to create EHR with the aim of making one, or also maybe more than one, several centers to concentrate on all individual health information in the country, because usually hospitals in Iran should report to the SEPAS by, for example, coding the specific disease, and this code can be created by MAXA system, that is for nomenclature and also for coding. And this is usually can report to the organization, because they should monitor hospitals well. In the current phase of implementation, a number of demographic, clinical, financial, administrative, insurance data elements or optionally or mandatory sent to the SEPAS, and from near 30 type of hospital information system. You know, in Iran, there are a lot of hospital information system with a lot of brands that usually hospital use. And because of that, it's necessary to report what, for example, they collected, what they processed to the biggest, for example, organization that now in Iran is Ministry of Health. One of the main purposes of EHR is providing access, and then this access is every time and everywhere that we, for example, want to, for example, report. And poor documentation of necessary information may affect clinical decision making, planning, policy making in healthcare domain, and that's why it's very necessary to have this, for example, regulation to, for example, report diagnosis and diseases for example, managing the future disease as well. These are the features and requirements of the SEPAS, the terminology and health classification system standards, that, as I told you, can adopted, and also it's based on MAXA coding system, and then data exchange standard like ISO, and data confidentiality and privacy standard rules, and that part 4 ISO 13606 6 communication facility that are established at the province level, as I told you, and all healthcare centers and health institutions are not now connected with each other, and the exchanges the problem that can be solved in the future. And the National Health Information Network has not been established yet. And computer equipment and facilities that we can see, and the database now located and adopted by Ministry of Health, and the stakeholder, as we know, citizen health services, patient, and everybody. What's positive feature of CEPAS? We know that we have in the start and end time and having a certain objective, being evaluative and having implementable phases and steps for this project. About the project success, a key indicator of this project is start and end time, and the time schedule is very important because it began in 2007 and continuing and to be completed in the future. And another feature of this project is having an objective, and this objective is was to create EHR, and that can be include all the health information before birth and also after birth, because of the nature of the EHR is to cover all the information of the people. And but however, this project hasn't achieved yet. Maybe when, for example, you see the top level and the data exchange is because of the lack of facility and infrastructure, data exchange, and failure to establish links between other organizations. And the project, the nature of project is any project should have resources, facilities, component, equipment that required to complete it, to complete the project. And also we can see this as a project management to achieve the goal. And also these resources and sources can include people, software, hardware, and also other components that can be needed to integrate all the components together. And that's what at the end we can expect, for example, data exchange at the final level. And another feature of the project should be evaluative, and evaluation can be defined as a decisive assessment of defined objective, and that can be based on the set of criteria and goal to solve a given problem. And we should prioritize that our goal to see, for example, which one is important for us, and then, for example, we should plan to solve the problem the optimal level, actually. And a comprehensive EHR technology assessment will help us to better understand the current state of our technology and prepare our practice for EHR adoption. Also, we can meet future needs. And evaluation CEPAS project is based on EHR system, and that will determine its advantages, opportunities, barriers, and deficiencies, and until that we reach the optimal level. And also each project we can, for example, divide it in several projects because we can, for example, focus more on a small project to improve the project management and provide the connection and link to the ongoing operation of our organization. And also we can, for example, see the project requirement based on complexity, size, resources, and that, for example, help us to achieve the goal, and we can work for it up to, for example, reach the optimal level. At the end, CEPAS project has some feature that, for example, having objective and being evaluative and having some required resources and having operational phases, but usually all the projects that have several deficiency. Firstly, it, for example, does not consider confidentiality and specific security because usually username password can be shared between each others. And for example, using digital health, usually we can see, for example, confidentiality and security as a challenge to use, for example, the devices. Secondly, the link is also currently limited to the healthcare centers. And we couldn't, for example, see the connection between healthcare and organization. As I told you, one of them is distance places and lack of hardware and software as well. And we can recommend that all stakeholder and policymaker should collaborate actively eliminate the barriers and deficiency to achieve the desired objective. And usually all we should collaborate from the first step and have a collaboration with, for example, this project. And from, for example, it can include physician, patient, everybody to achieve the optimal level. And thank you so much for your attention. If you have any question, I'm here to answer it to you. Thank you.
Thank you. Thank you very much indeed, Dr. Husna. Although you are a PhD student, but a future doctor, I'm sure, with this brilliant presentation. Dr. Husna did actually highlight the project that is actually being implemented in Iran. And among the most important features is actually the focus on the electronic health record as a core in the digital health, interoperability, fragmentation, and the scoping of the project are among the challenges. And I really encourage all of you to ask and question the significance, the importance, and the steps that have been taken to do the project, including the importance of the electronic health record. And the more important thing is what has been highlighted by Dr. Husna is the number of electronic health records that exists in hospitals in Iran. Of course, Iran is unique in terms of having the Ministry of Health and the medical education as one part or one parcel. So thank you so much indeed, and I trust that you will continue to be with us because I'm sure there will be questions, and I have in mind a few questions to ask you as well. So thank you so much indeed. The other lady that will be presenting is from Syria, Dr. Hiam Bashur, and she is actually, she works for WHO country office in Syria, and she has been working as professor of epidemiology and community health in that particular country. And you know that this particular country is under crisis because of the civil war and because of the challenges. So Dr. Bashur herself actually did serve actually as a member of the WHO Strategic Advisory Group of experts on immunization, which is abbreviated as SAGE. And she was the chair of the Regional Verification Commission for measles and rubella, as well as hepatitis B in the Eastern Mediterranean region of WHO. I would like to mostly welcome Dr. Bashur, and so she will speak on in a country that has been in crisis over the last few years, and I'm sure the experience that has been gained in Syria will be reflected in a number of other countries, including the countries in crisis. And in the East Mediterranean region, We know that most of the countries are in either economic crisis or crisis in civil wars or in being attacked or so. So with this, I would like to welcome Dr. Bashur for this session and ask her to make her comments and to make her presentation on digital health perspectives from Syria, a country in crisis perspective. Dr. Bashur, go ahead.
Thank you so much, Dr. Shorbaji. Can you please confirm that my voice and the screen are okay?
Yes, indeed. Yes, indeed.
Okay.
Your
Thank you so
voice,
much.
your picture, and the presentation are
Thank
very
you.
clear.
Thank you so much, Dr.
Great to see you.
Shorbaji. And good morning to you and the colleague. And thank you so much, Mr. Chair. It's a really great opportunity to be part of this series of webinar for the COMSAT. For that, I really am grateful and I'm pleased to be part of this. And I do thank the organizer for inviting me. So the outline of the presentation is that I will put the country in perspective, as being in the title, is a country in crisis. And then I will highlight the digitalization in Syria. What are the current digital intervention for health system strengthening that's supported by WHO country office? And then how COVID-19 specifically has accelerated digital healthcare. What are the enabling factors? What are the constraints and way forward and the roadmap? So with regard to Syria actually, as you all know, or most of you know, I mean, the country has made really very, very good progress for the MDGs. That's prior to the war. So I remember the third report for the MDG, the health indicator, were really in a very good shape. However, since 2011, certainly there was a major disruption in the healthcare system. We do have the fragmentation of health governance because of the security situation, because of the political situation. We function as whole of Syria approach. Shortage of healthcare. I mean, more than 50% of the healthcare force, they've been depleted out of the country. Insufficient level of national funding on health, of course, with the massive dependence on external aid. That's because of the crisis. Health cost has dramatically increased, and we do have, even prior to the war, high out-of-pocket expenditure. Certainly, Syria was one of the main producers of medicine and with exportation to over 40 countries. However, this has been badly affected since the war. We do have, I mean, issue of quality of care that's relevant just to mention. So since 2011, you can see people in needs, that's the HNO for 2023. Since 2011, Syria protracted a crisis with extensive death toll and massive destruction to the country infrastructure. Currently, over 6.7 million IDPs since the onset of crisis, including 2 million in camps and settlement. Continued, I mean, that's not to mention refugees to neighboring countries. Continued political and security instability and deterioration of economic situation. I mean, currently, I think the highlight for the last 2-3 years in Syria is not the security, is more the issue of the economic deprivation, which is really the highlight. This has been further complicated by the COVID-19 pandemic and the recent 6th of February earthquake that's really have hit the country and badly affected all aspects of life. The report for the SDGs, the first national report that's been produced 2019 for the SDG actually highlights some of the indicators, which I'm not going to go into the details. The report is available, but what I highlighted the SDG, specific SDG that are relevant to our webinar, which is the digitalization. So we're focusing here on the health system. So we're talking about SDG 3, but there are other indicators with regard to SDG 4, 8, 9, 16, and 17. With that point, it's really very important to note that the country have produced a report which is called Syria 23, or it is called sort of post-war Syria. And this is a national strategy for 23, which align with the SDG agenda. If we look into the highlight into that sort of vision for the country, it's really talking about institutional building and integrity strengthening, infrastructure and service development and renewal, growth and development, human development, social and educational dimension. That's where health fits under 3 and 4, but also the national dialogue and political pluralism. What's really very important is that one of the projects under this vision is called digital transformation and e-health. Now, if we look what has been progressed after that, we see that the strategy for digital transformation has been actually drafted and it is in progress in implementation. However, the strategy has been really the product of work of the whole government, but largely the team within the Ministry of Communication and Technology. So this is a national strategy for digital transformation where health is there. The aim of the strategy is to increase the contribution of the information and communication technology ICT sector in Syria to the gross domestic product, bolstering transparency and contributing to fighting corruption. So that's the vision of the strategy. Project 3 in that documents, it's referred to the e-health. And what's really they are talking about is the electronic medical record that's working with the Ministry of Health, linkage of hospital and as well as insurance company. Now, if you remember SDG 3, we're talking about good health and well-being. And for that one, I'm going just to highlight one of the indicators that's achieving universal health coverage, including financial risk protection, access to quality essential health service, and access to safe, effective, and quality care. And for that one, where the commitment has been really strong toward, globally and in Syria, one would like to use this framework that's been, I did borrow this from the WHO guideline recommendation on digital intervention for health system strengthening. I'm sure Dr. Shorbagy you're aware of. And this was called Tanahashi framework. For that one, the potential for digital health intervention is really very much great. And I thought that's really very much a good framework whereby those intervention would help in all dimensions, largely in sort of providing the demand and the supply. And for that, bearing that in mind, it might be very relevant just to bring what's really here at the WHO country office. We are supporting the Ministry of Health and others. So current digital intervention for health system strengthening, largely led by the HIS unit, Health Information Unit, and supported by others, it's really first of all was called the supported system for emergency, largely the HERAMS that was established in 2014, which is health resources and service availability monitoring system, has been really very, very I would say very useful during the emergency in terms of reporting on the functionality of the primary health care, the hospital, public hospital, but also the early warning and response system, which is the EWARS, that's very much important for the outbreak prevention. Now, there is another project which is called the Rapid Mortality Surveillance that's under the Civil Registration and Vital Statistics System, death notification under the DHIS2. So this is a platform where we have the rapid mortality surveillance there, and we started to get the data, and it's, I mean, it's quite okay in terms, I mean, even the earthquake, we were able to, to find the data from that system, which is, it means that is very much valid. We're supporting the Ministry of Health with establishing the routine health information system. That's for the PHC, for all the primary health. And this is doing quite well at the level of the district, but less at the level of the PHC themselves. And because still is there more paper-based, and I will explain the reason during the discussion of the challenges. We are currently piloting the hospital information system, electronic medical record, in 6 hospitals, and that's supported by the HIS unit in the WHO country office Damascus. And I think it might be relevant and fair enough to add some of the work for the mental health technical working group that's co-chaired by WHO, that they've been doing quite good in terms of using the technology actually for passing the message or for protecting the people. Now, COVID-19 has been really, as my other colleague has mentioned, is really very much an issue whereby it did accelerate digital healthcare. In Syria, I don't promise that I have all the data for this, but what I've seen, of course, we have introduced surveillance technology, for example, at the point of entry. But during the pandemic, the issue of the telephone and online consultation, WhatsApp group were very much the title for the provision of care by private sector and civil society. So they've been really the lead in establishing such initiative, just, to provide care from distance to the affected people. As I said, we don't have data from the private sector, but they've been very much active. What's really was very much important in terms of the digital health is the issue of the management for the misinformation. And that's where WHO country office has really been using the, messaging and the website for this. Teleworking arrangement for some of the people. And finally, and that's quite important, is the digitalization of COVID-19 record for the vaccine that's been supported by the office in favor of the Ministry of Health. I'll move now to some of the enabling factor, which is really, I would say, political commitment from the government. It's very much important. It is an enabling factor, as you have seen, sort of the national strategies that are on board. Certainly, increasing use of smartphone and technology, one needs to admit. A strong private sector in Syria, whether in healthcare, but also in the technology, that's very important to highlight as one of the enabling factors. And of course, we need to admit that there is some technical and financial support from UN organization, including WHO office, and I gave some example of what we're supporting the Ministry of Health in. The list of constraints and challenges is much more longer than the list of enabling factors. So one could really start by organization structure. I highlighted that the National Strategy for Digital Transformation is MOCT. They are working with other Ministry of Health, but within the Ministry of Health, I think one need to look at some of the fragmentation, whether it is a Department of IT, or it is a Department of Planning, or it is Department of Hospitals. So one really need to look into this quite carefully. Certainly, that would implicate duplication, would implicate lack of integration of information system, lack of harmonization by projects. So, WHO supporting one, UNDP supporting other, etc. The socioeconomic situation is the title currently in Syria, with 90% of the people are in poverty situation. Lack of fuel and electricity has been really very much an issue in the country. And that's where, as I said, PHC, they still using the paper because, you know, the connection and the electricity and etc. That's why we're really finding difficulty in scaling up this routine health information system. We have, I must admit, you know, issue of attitude, difficulty in behavior changes in people, you know, moving from paper-based into the electronic, etc., use of technology. Lack of connectivity is a highlight in the country. Technological capacities, plus and minus, it depends on what you're talking. If you're in some of the institutions under the Ministry of Higher Education, they're quite advanced. In some other places are less. The workforce shortage, some other colleague has highlighted, but also the workforce training for digital health and digitalization is important. I must admit that the culture for data utilization is still weak, and we are working with the Ministry of Health to improve that. Funding has been a challenge for us here in the WHO country office, because all the fund is going to the crisis, a humanitarian response, very much little or nearly nil on the development. It's a really donor appetite for the development fund is very, very low. So we are facing this challenge, not to mention or to add the sanction on the country, actually, that's been hampering all the work in the country, whether for the government or even for the UN organization. So the way forward, one might be borrowing, you know, this, I'd like this framework in the global strategy, which is the commit, which is there. We need more to catalyze, measure, enhance, and iterate. The last slide is really, I mean, this has not been discussed with the Ministry of Health, but this is how I'd like to present it to the Ministry of Health if I was in a position to do that. So first of all, we need to set the foundation strong. You know, the infrastructure, the connectivity, this is really very much important. We need to roll out priority service. What are the priority service? Electronic medical record, then let's do that. And then we need to expand and diversify. This is a very important when we prove the success in some of the priority service. And finally, we need to achieve the full potential, inshallah. As I said, the strategy is at the level of MOCT. There is no national strategy for digital health at the level of the Ministry of Health, but we're trying really to advocate for that. I'm done, and thank you so much, Dr. Shorbagy, and participant and organizer. Over.
Thank you. Thank you so much, Dr. Bashir. This has been really, really very good and very useful and relevant, especially the last part that you are intending to go forward and go ahead with talking to the Ministry of Health in particular. I know from past experience that people in WHO, they like to work with the Ministry of Health as their counterpart. You did highlight actually the need for digital health, even for a country in crisis. And Syria is one of the countries that have been suffering over the last 10 years as a result of the human crisis and migration and all that. Now, the thing that you have already highlighted is the lack of engagement, I would call it, in the Ministry of Health, or not being invited, which means actually, and in many countries, this is the case, unfortunately, that the Ministry of Telecommunication takes a lead in development of the digital transformation strategy, including health. And the most important thing in digital health or e-health is actually that it should be led by the health people. And whoever is actually interested in providing support is actually invited to do so through the Ministry of Health or the Health Authority. Use of data is another issue that you have also highlighted. So thank you so much for all the highlights that you have given. And thank you so much for being part of this. There is a lot of information that is missing, which you did highlight and you did actually provide. And it's an eye-opener for external people to see what's going on in Syria in terms of crisis, in terms of the earthquake, in terms of digitization, in terms of digital health, and the challenges that are entailed and the challenges that are faced. So thank you so much for all that. Thank you. Now it's my pleasure to introduce Engineer Ghada Ballout. Ghada is actually is the project manager for UNRWA. UNRWA is the United Nations Relief and Works Agency for Palestinian refugees in the Near East. Dr. Ghada or Mrs. Ghada has a master's degree in information technology management from the UK and a computer science from Jordan University. She has actually been the brain behind the UNRWA e-health system that she is currently managing. Prior to that, she did actually work in a number of other institutions, but the highlight of her career is actually being in charge of the e-health project in the UNRWA, which covers 5 countries, the refugees in 5 countries. And Dr. Mrs. Ghada, Engineer Ghada, is the best actually to talk about what has been achieved and what has been the promise and what is the need for digitization of health as part of the UNRWA services to the refugees in these countries. Mrs. Ghada, the floor is yours. 10 minutes. Mrs. Ghada.
Sorry. Thank you,
That's
Dr.
okay.
Najib, for this introduction, and nice introduction. And thank you for the organizers. It's my pleasure to join this webinar. And I will start just talking about our journey with e-health in UNRWA. Is it clear, the presentation?
Yes, indeed. I think it would be a little bit better if you just turn it to slideshow so that we can see the full picture of the whole thing. Just click slideshow.
Yeah, I'm clicking, but it's okay. Very.
It's a bit slow. That's okay.
Slow, yeah. This is about the e-health system in UNRWA, which we call it a quality leap towards distinctive primary health services at UNRWA health centers. First of all, if you don't know UNRWA, UNRWA is the United Nations Relief and Works Agency for Palestine refugees in the Near East. UNRWA is the main provider for health, education, relief, and microfinance services to more than 5.9 million Palestine refugees in its 5 fields of operations: Jordan, Syria, Lebanon, West Bank, and Gaza. These services are provided through 140 health centers, primary healthcare centers. The e-health started in 2009 and was gradually introduced, deployed at the health centers across the 5 fields of operations. Of course, gradually, because funds were not available upfront, and it was really challenging to have all health centers equipped and ready beforehand. The latest version of e-health catered for UNRWA's health reform, with a person-centered family health team approach. This was rapidly rolled out by 2017. 2 mobile apps were developed after the rollout, namely EMCH for the mothers and their children in 2017, and ENCD for the non-communicable diseases with diabetes and hypertension in 2020. The main objective is improving the health status of Palestine refugees through the improved quality and efficiency of UNRWA healthcare services. Also facilitating patient flow within the health center, responding to the increasing workload due to the population growth and increasing number of non-communicable diseases patients. The current e-health system includes the following main modules with more than 3 million patients records and more than 3,000 users agency-wide. The first module is the non-communicable diseases for diabetes and hypertension, assessment, case management, refill, and screening. The second module is maternal health care, which includes antenatal, postnatal, pre-conception care, and family planning. The third is child health care for newborn assessment, child assessment at 1 year and 3 years, immunization, growth monitoring, and disability screening.
Dr. Gada, can I interrupt?
Yes.
Still, we cannot see your full screen. Are you changing the slides?
Sorry. What are you saying now? eHealth main functions?
No, it's just the first slide that you showed.
Sorry, all participants are the same or just Dr. Najib, can you?
Dr. Najib,
No, what I can see is actually slide number 13, not in slide show mode. So while you are presenting, it would be good actually if you slideshow the rest of the presentation.
It is now in slideshow, but I don't know.
Yeah, it could be that the connection is bad.
Okay, yes.
You need to reshare again, Dr. Gada.
Sorry?
No, it's.
Yeah, now it's moving.
Is it good now?
But still, it's,
Yeah,
it's
go ahead.
vision
Go
mode.
ahead. Can you see the eHealth main functions?
Yes, it's slide 5.
Okay. Thank you. Also, there are some other modules like outpatient care modules for curative dental services, specialists, mainly cardiologists, ophthalmologists, gynecologists, and hospital referrals. Also, we have supporting modules, laboratory module, which is integrated now with the Sysmex machines for CBC tests, and pharmaceutical module, including medicines dispensary and stock management, which is integrated with the ERP system, SAP in UNRWA. Lately, we have introduced ICD-11, telemedicine, home delivery medicine, as well as emergency mode. Those were added lately during COVID-19 pandemic. As you said, COVID-19 have accelerated the eHealth implementation current status now. Almost all health centers in Gaza, 22, Jordan, 25, West Bank, 43 health centers, Lebanon, 27 health centers in Syria, 21 out of 23 health centers are fully implementing the eHealth. The remaining 2 health centers in Syria have no means of connectivity. This is why they are behind. We are trying our best to connect them through different means, but some because of security issues and some of political reasons we are not able to connect until now. The other implementation is for the 2 mobile apps, the ENCD and EMCH. The number of users for EMCH are around 250,000, 244,000, while the ENCD is 148,000. It's worth mentioning that the ENCD is not only available for UNRWA users, it's also available for non-UNRWA users. Any user who speaks Arabic and can read the Arabic can register and have the benefit of this ENCD app for diabetes and hypertension. I will not go through the benefits in detail. I will leave this to my colleague, Dr. Zuhair in Gaza, to dig into the more details on the operational level. However, this system have reduced staff workload and daily operations, i.e., for example, patient time to get full service was reduced by 72% using the eHealth. The 2 mobile apps, ENCD and EMCH, have empowered beneficiaries to see their health records and communicate with healthcare providers, get reminders of their appointments, and medications, get notifications based on their health status, etc. The main challenges also, I will not focus too much. I will leave it to Dr. Zuhair to have more detailed challenges in Gaza, and mainly challenges are common in low settings environment, but Gaza have special environment, as you know. So those challenges are tackled through different solutions. For example, the lack of adequate infrastructure. This was gradually improved by fundraising, hosting outside premises and UNICC, turnover of qualified IT support. We have trained super users as a backup in each health center. For the capacity building training, also different types were conducted, and we have online training courses for new users. Connectivity and power cuts in Lebanon, especially in Lebanon and Syria. We have backup connectivities whenever possible, of course. For example, in Lebanon camps, there is no means of alternative connectivity. In Syria, you know that it's better, 4G is the alternative, so it's not too much reliable. We are using laptops, of course, to save energy, solar generators, etc. The plan for the next year, this year and next year, we will establish additional online training for better monitoring, reporting, and dashboards. Sustain the infrastructure, as we said, upgrade eHealth with important needs like integration with laboratory machines, etc. And we, of course, have some needed additional modules like mental health, school health, etc. We're addressing having a new system to cater for all this. And since this one became old and there is a risk of adding new modules to this system. And of course, we are aiming for assessment of the ENCD and EMCH applications. With the infographic of e-health system in UNRWA, I would like to thank you all for your patience, and hopefully I can share the presentation if you are not able to see all. Thank you.
Thank you very much indeed, Mrs. Ghada, and for the presentation. I think it would be worth and important to share it with the organizers and the rest of the team, the participants themselves, so that they can actually have the highlights of that. The Palestinian refugees is actually a different story from the rest, especially that the refugees are distributed in a number of countries, and each of the countries has its own health care system, and compatibility, fragmentation, and working together is really important. The other big challenge, as I can see from the presentation, is actually the resources and the different uses of e-health. So thank you so much indeed, Mrs. Ghada. And now, not the least, the last speaker is Dr. Zuhair Al-Khatib from Gaza. And Gaza is one of the areas that are covered or served by the UNRWA. And we know that the Gaza Strip is actually under siege for the last X number of years, and they have been suffering as a result of that. Dr. Zuhair himself actually is a graduate of the in Palestine, a master's degree in public health and a BSc in medicine from Pakistan. And he has been working for WHO, for UNRWA for over the last 15 years. And a number of reforms have been taken place in the e-health system under the leadership of Dr. Ghada and Dr. Zuhair, and of course the team as well. We would like to invite Dr. Zuhair to make his presentation over the coming few minutes, if possible, and to highlight the different challenges that are faced in implementation of the e-health system in Gaza in particular. Dr. Zuhair, the floor is yours.
Good morning, Dr. Najib. Good morning, colleagues. First of all, I would like to thank the organizers and yourself for inviting us to this webinar, which actually talks about an important issue that is considered the future of the health services, and how far we can go with the health service provision in the Middle East countries, as well as in Palestine. But let me check first that whether you can see the presentation or not, or am I clear? Is my voice clear?
Your voice is clear. Just make it a slideshow so that we can see the full picture of the presentation.
Is that okay?
Yes, indeed. Go ahead.
Okay, thank you very much. Now, for those who do not know Gaza Strip, Gaza Strip is a small place in Palestine. It is actually 365 square kilometers. Gaza Strip is considered one of the highly dense populated area in the world. We have approximately 2.1 million people, including 1.4 million Palestine refugees. They constitute 2/3 of the population of the Gaza. The health providers in Gaza include the Palestinian Ministry of Health. They provide primary and secondary health care. UNRWA provides only primary health care, through its 22 health centers. Other United Nations organizations, they provide the service through the support, actually, like the UNICEF and the WHO office, national NGOs, as well as international NGOs. Now, the UNORWA Health Services, UNORWA provides a comprehensive primary health care services covering both curative and preventive, in addition to the supportive services like the laboratory, pharmacy, and hospital support services. Actually, UNORWA in 2010 started a health reform by adopting the family health team approach, which is a family-centered healthcare. And actually, it adopts a life cyclical approach to management of health issues. Now, recently, and in collaboration with the WHO office in Gaza, the mental health and psychosocial support services are integrated into the health services and is provided in all health centers, the 22 health centers of UNORWA. The key concept of providing the health services is the family health team approach. We're not going to talk about the family health team approach, but in brief, a family health team is a team that looks after a number of families. The team consists of a doctor, who is the medical officer, and a practical nurse or a nurse who manages NCD patients, a nurse who manages immunization and growth monitoring of children, and a midwife who manages the antenatal care for the registered pregnant ladies. Now, the e-health background, the electronic health system, strengthened both the quality and efficiency of health services provided by UNORWA in all fields. In 2022, UNORWA provided different health services to more than 1.3 million Palestinian refugees using the electronic health, which is the electronic medical record. And as Ghada mentioned, using different modules like the non-communicable disease module, which focuses mainly on diabetes and hypertension, the maternal and child health care, and the maternal one, which starts from the preconception care to the postnatal care. And the most important one is the child health care system, or the child health care module, which covers the management of children from infancy till they are 5 years. All health centers in Gaza uses the e-health system. Actually, we have more than 900 well-trained healthcare providers. I'm talking about the permanent staff or the fixed term staff who are UNORWA staff members or who are healthcare providers. Now, the electronic system in Gaza field office includes not only limited to the electronic medical record, which is actually the family health team version, adopted to meet the requirement of the family health team and to help in implementing or keeping the family health team in place. The hospitalization management system, which is a system that is outside the electronic medical record, but we refer patients from primary health care centers in Gaza to the contracted hospitals with UNORWA using this system. And this actually recently implemented in Gaza. The the mental health and psychosocial support subsystem, which is an access-based, it gives us an overview of the situation regarding the mental health in Gaza, the number of cases, the newly registered patients, the patients who need medication, etc., etc. And as Ghada said, the electronic NCD and the electronic maternal and child health mobile applications that has been developed to facilitate the health education as well as the patient's engagement in the service. The availability of the management protocols, actually, this is an advantage that we've had. The management protocols for all services, including the non-communicable disease, including diabetes and hypertension together, the double burden, the maternal health, the child health, the family planning, and everything. We've had the management protocols and guidelines that actually supported the development as well as the implementation of the e-health system. This is an example of a dashboard with the entire data extracted from the electronic health or the electronic medical record. Now, it tells us how many patients we have for the NCD service. It's more than 100,000. The remaining pregnant ladies, patients with the MHPSS, patients with the how many consultations we've had in the last year, and you can extract the data on monthly, quarterly, and annual basis. So this is an important tool actually to be used in management. The health implementation, the e-health implementation of the in Gaza started in 2012 and was completed at the end of the 2016. And this was the non-family health team version. Previously, we used to deliver the service using the vertical system. A patient attends the health center. If he has an uncommunicable disease, say diabetes or hypertension, he goes to the NCD patient, so NCD doctor, and for management. A pregnant lady goes to the a female doctor or a doctor for who manages the maternal health cases. But now the situation has changed after the implementation of the family health team approach. The methodology of deploying the e-health system was in phases, actually. The first one was the data entry of the handwritten patient's records, like the NCD. We've had a handwritten, I would say, a patient records for every category of patient, and we had to do a data entry for the entire number of records inside the health center beforehand. And again, the on-job training for the health staff at every health center, we have implemented the e-health. Now, implementation of the e-health started using the classical version and was upgraded to the family health team version that adopted the family health team approach. The family health team e-health system is under continuous development and update to meet the new requirements and enhance additional functionalities. And actually, recently we have updated the diagnosis. Instead of using the ICD-10, we are using ICD-11, and it actually the e-health system or the electronic medical record has helped us a lot during the the COVID-19 pandemic in implementing the telehealth, having a proper medical records for the patients, so we could actually control the issue of electronic of telemedicine. Now, the overall objective of any health system is to improve the quality of the health services and client satisfaction. Data, the other important one is the quality of data. We need to have a clean, complete, and accurate data. Facilitate operations and business practices. Support data collection and reporting that provide accurate information to management for decision making. And actually, this is a very important part of the e-health. All patients' information is in one electronic profile: medication, management, visits, history, everything. So that ensures the continuity of the service and ensures that there is a quality care provided when you have the entire or the all information needed about your clients or beneficiaries. Now, the benefits of the e-health: it saves time and efforts of the staff. It reduces the paperwork, and again, this is an important issue. Prevent duplication and control provided services. Prior to the implementation of the e-health service, it was difficult to trace whether this patient has a file or receives a service in X health center, and at the same time he receives a service in Y health center. But using the electronic medical record has prevented this duplication and had controlled the services properly. Improving management quality through the key performance indicators. There is improvement in the key performance indicators. Actually, there is a proper calculation of those indicators. I'll give you an example. In addition to other issues which has been taken by UNOVA in Gaza to improve the quality, like the family health team, the e-health has helped to improve the number. One of the key performance indicators is the number of consultation seen by the medical officer per day. Prior to the implementation of the e-health, it used to be 120, but after the implementation of the e-health, it reaches 70 and even 60 now. Enhancing security and privacy of beneficiaries' data. And of course, the money issue, which is the cost effectiveness. Now, other benefits include that improve the flow in the health center using appointment system and reduces patients and reduces patients' waiting time. Now, the issue of appointment, that when you give a proper appointment within a proper time frame, this means that you will have a proper flow and improve the flow that would give the patient the chance to be properly assessed and managed by the doctor. Accurate drug monitoring and management. This is an important tool as well, an important issue. Excellent monitoring and supervisory tool for supervisors. Improve the screening activities, because it tells you who needs a screening. That if you adopt, we in UNORWA adopt the at-risk screening for, say, for example, for breast cancer, when we have projects for the diabetes and hypertension, which is for the patients who are above 40 and those with certain other risk factors. Easy and accurate identification of needs. Now it tells us how much, how many doctors we need, how many nurses we need, depends on calculation of the workload, and of course the research applicability. Now the challenges, and actually this applies to all UNORWA fields. Establishment of the infrastructure, mainly at the beginning of the implementation or developing the electronic health, there was a logistical issue, that how can we find the where can we find the money needed to implement or to prepare the infrastructure for such I would say a big event. Lack of basic computer skills among the health staff. Some of them, they are old and they are not really well acquainted with the computer skills. So this was a challenge. Capacity building and training of the health staff while providing the service. This was a big challenge. You know, you need to implement a new issue. You need to train people at the same time. You don't want the service to stop, because we have actually a lot of consultations per day. The stability of the e-health system functionality, network and electricity issues were also among the challenges in Gaza. Connecting the system to the other systems in the country at different levels, primary and secondary. We have our own system. The Ministry of Health, they have started to have a system, but it is not mature yet. They have a system partially implemented in some of the primary healthcare centers, partially implemented in some of the hospitals. So connecting the systems together, this is again another issue and one of the challenges. The biggest challenge is of course, the sustainability, how to sustain the e-health. In our case, resources are the biggest challenge. To be honest, money is the biggest issue in regard to improving and implement and keeping the continuity of the service for the Palestinian refugees in Gaza and even entire the agency or agency-wide. The population growth is another challenge. The growing system, you have more records for the patients, so definitely you may not be able to store those. You need a storage place, you need to have a data management and issues like this. And the fast developing technology, we have to cope with this and we have to be in line with it. Now, how to overcome the difficulties?
Can you try to finish in 1 minute, please?
Yes, I have only this slide, Doctor. Availability of the qualified supportive e-health team. Actually, they have eased the process, preparing e-health online training videos, continuous update of the e-health system to meet the additional requirements, continue fundraising UNORWA to maintain service delivery, work with partners to have intermediate systems. And thank you very much, Dr. Najib and colleagues. Thank you very much.
It's a pleasure. Thank you. Thank you so much indeed for highlighting the challenges and the different achievements that have been made in a place where we know that it's under siege, we know that it's in a crisis, we know that there are difficulties in population, in electricity, in all areas of life. So thank you so much indeed for highlighting the need for digital health or e-health in resolving some of these issues. I must thank all of you for the excellent presentations that you have made and for the interventions. May I ask everybody to sort of switch on their camera so that we can see each other for the coming few minutes at least. And I would like to give a very quick summary of what has been done actually or highlighted, and then invite Dr. Zakaria to say a few words, and then maybe one or two questions that I am interested to have the highlights. Number one, the health for all as a theme. There is what is called universal health coverage, which means every person is actually entitled for healthcare. There is emergency and crisis situation in health and in the region that we know of different things. Digital health is being implemented in healthcare institutions in the countries. The other thing, the EHR is actually a cornerstone that most of the systems are focusing on. So whether you have telemedicine or you have digital health normal or whatever, the electronic health record is the corner. Of course, there are challenges in terms of the infrastructure, in terms of human resources, in terms of policy and governance, in terms of fragmentation and use of standards. The other thing, which is a very important thing to mention, we have noticed the commitment in these countries to digital health so that they can actually achieve universal health coverage using digital health or enabled by digital health. So thank you so much indeed for all your interventions and for all the different perspectives that you have given in the countries that you are representing or you have spoken about. Now, before we close, two important things. Number one is to invite Dr. Muhammad Nafis Zakaria to say a few words before actually we go into the session of maybe one or two questions before we close. So, Dr. Zakaria.
Thank you very much, Dr. Najib. I want to thank profusely and profoundly all the participants who have shared their experience and their vision about digital health. I understand that this particular session or this kind of events are basically meant for sharing each other's expertise and learning from each other's experience and then benefiting each other so that we remain self-reliant in the context of digital health or any other sphere of activity pertaining to ComSets or its partners. I have asked my team to make note of all the salient points of the presentation that have been made here, particularly the weaknesses, or I would say the shortcomings or challenges being faced by various organizations and countries in order to achieve their accomplish the job of transforming healthcare more and more into digital form. So since we have ComSet as being a intergovernmental organization of 27 countries with 24 centers of excellence, and our own at the headquarters level expertise and experience in the digital health, I have asked them to suggest and write back to all of you, all those who may be in need of some sort of assistance from us, that how ComSet would be able to assist you in accomplishing your goals and objectives that you have set out for yourself, whether it is individual countries or the organization of a particular member country or the UN, subsidiaries. So thank you very much to everyone. I beg leave because I have another meeting which has already started. We overshot the time which was kept for this event. Thank you, everyone.
Thank you so much. Thank you so much indeed for organizing this webinar and for inviting everybody to be part of that and for highlighting the different achievements and challenges that are faced. So thank you so much. Shukriya. Bye-bye. Okay. So within the coming few minutes, I want to sort of ask everybody, if possible, to open the camera so that we capture the event itself. This is number one. Number two, if there are questions from the audience, they are most welcome to ask. Number two, the other important thing that I wanted to ask is to ask the speakers to maybe one or two questions within the coming few minutes. The importance of infrastructure, the importance of human resources for digital health, and the importance of having policies and strategies and governance infrastructure and the rest of it, and the fragmentation and the use of standards. So I would like to invite number one, Dr. Vajiro, to highlight the importance of policies in that. He did actually highlight the need to develop policies that are related to digital health, at least in the Commonwealth countries. Dr. Vajira, in 1 minute, can you please highlight the need for policy setting?
I think the key need for policies is that without a policy, governments don't move. It tend to be, individual projects. So therefore, it is very important to get the high-level policy commitment at either government level or even intergovernment level. Sometimes governments in the low middle income countries tend to draw on the World Health Assembly resolutions and other strategies and global strategies and plans of actions and so on to develop their policies. But whatever they do, I think it's very important to have the policies in place. The second reason why the policies should be in place is that then once such a policy framework is in place, whoever the key officials are in these positions, then they have a mandate to take an initiative forward because in this space, especially in digital health, there is, I think, high level of mobility in terms of personnel who are working in this space, and so therefore, I mean, I'd like to even use the word brain as it were. A lot of people who I find working in certain countries, they are just gone within a month or two. And so therefore, unless policies are in place, then there is no long-term mandate to taking these initiatives forward. And of course, thirdly, for the funders, whether they be international donor agencies or the government, or even within government, various agencies and so on. Unless a policy is in place, there is no clear direction as to what would happen with their funding. So I would think those three as being key reason why policies should be in place, and the government commitment, the ministry level commitment, and other levels of commitment depending on the structure of a country, the organization of health systems in a country, frame, those should be in place. So, Najib, I think those are the compelling reasons why we should have policies in place.
Excellent. Thank you very much indeed from coming from somebody who is experienced in policy setting and in implementation of digital health, and somebody who has actually loved the digital health and being a professional physician, clinician in love with digital health. So thank you so much indeed. My second question, or the other area, is I wanted to ask about the need for standards and interoperability. Mrs. Ghada, your e-health is actually functioning in almost in 5 countries or places, geographic. And it has been actually highlighted that different countries have different standards, different methods for connectivity, but the most important thing is to connect the Palestinian refugees with using digital health with the health systems that you are actually trying to provide or to govern. So can you spend 1 minute on the need to standardize and interoperability within the framework of what you have been doing in different countries, Jordan, Syria, Lebanon, West Bank, and Gaza?
Thank you, Dr. Najib. Yes, indeed, this is a need that we have to integrate and have interoperability with other other systems, the Ministry of Health systems mainly. However, we have catered some differences in our health system regarding, for example, the immunization program adopted in each country. So the system is flexible to adapt the immunization program according to the country, the patient country or field of operation. Regarding the interoperability, there is some, of course, discussions, but this is more political to have this exchange of data between the systems rather than technology-wise, it can be done. Political discussions and reasons might prevent some data sharing. However, we're trying our best to have the best agreed data set that can be shared between our system and the other Ministry of Health systems. Thank you.
Thank you. Thank you very much indeed, Mrs. Ghada. This is excellent, and I really appreciate your response to that. Now I move to Dr. Bashir here. The role of infrastructure, as has been highlighted in a number of presentations, how important to have the ICT infrastructure, the infrastructure in hospitals, in clinics, in different people's mind. How important do you think is that? Can you make a comment for like 60 seconds, 1 minute? Go ahead.
Okay, thank you so much, Dr. Johar Baji. That's very relevant. And if I may link it with your, not the previous, the pre-question to my colleague from the Commonwealth, because I mean, this is, the Syria is an example where policy are there, the strategies are there, and the buy-in by the government is there. But however, I mean, the major dilemma and the main challenge is really to do one with the infrastructure available, and that's because of the economic situation, because of the sanction, etc., but also because of the organizational structure, I would say, because I mean, this sort of a fragmentation and I would say lack of coordination, organizational structure between different ministries, different departments within ministry, it's really an issue that would decrease the efficiency, that would decrease even the availability, because it's going everywhere, but it's going sometimes nowhere. So to me, it's a major challenge. What we can really improve it is just by putting a proper organizational structure in place, but also admitting that, I mean, the country is in major needs that's to be met at some time. Over.
Thank you very much indeed. Now, related to that is the human resources, and it has been highlighted by Dr. Bajiro through the establishment of the master's degree program. I know that Dr. Husna, being a PhD student in health information management, and is actually implementing in their project about e-health or digital health, how important to include human resources development as part of the strategy in the digital health at the national level. The floor is yours for 1 minute, Dr. Husna.
Yes, thank you so much. Because of my experiences in developing an application also for cancer patients, I can say that for the first step, we should persuade physician, for example, patient, to collaborate and join us to, for example, continue the steps together. Actually, it's very important, and also the need assessment from the human resources and also specifically patient and physicians very important too, because first of all we should know that for example what they need for example what they expect for example developing a system and how for example this system can ease their workforce and workflow and how for example this system it can be beneficial for them to continue for example, the process in easiest way, actually. Yes, thank you.
Excellent. Thank you. Thank you so much indeed. Now, my question to Dr. Saverio, the role of digital health, as you can see it in crisis situation and emergency, how you can envisage, how can you see that digital health can solve or help in solving some of the data communication and data collection and management issues that relate to situations like in crisis or emergency? Dr. Saverio.
Many thanks. A very relevant question that goes beyond the response. It goes in the preparedness. Preparedness, I mean also the cycle management before the crisis happens. And I really like, to emphasize the question by Irfan about the chat box, because I mean, it was quite relevant during COVID-19. It will be more and more risk communication, community engagement. So whatever we manage to find through digital technology to face infodemics, misinformation, this will be more and more crucial in the coming years to prevent, prepare, and respond to crisis. Of course, another areas of incredible importance is surveillance. Surveillance, we need really to reduce the fragmentation, have an integrated approach with indicator and event-based surveillance, with clear standards and with clear platforms, with well-defined access and management by all the relevant stakeholders. Thank you.
Thank you. Thank you very much indeed. Thank you. Now, the last but not the least question, which is very relevant, I suppose, and the issue that is actually much more relevant than a number of other things, which relates to the funding of the digital health projects or initiatives or activities in countries. May I ask Dr. Zuhair Al-Khatib to comment on that in terms of what is actually lacking? How can the global community contribute into that, and how can the national institutions and the funding agencies contribute to that? Please go ahead.
Thank you, Dr. Najib. Now, this is a very relevant issue, actually. For organizations like UNRWA, for example, that totally depends on the donations from different countries to provide the service. This is an important that we continue fundraise this issue because of its importance, and it is really cost effective. With regard to the other organizations, I would call on the WHO office and the other UN organization also to be part of this fundraising issue related to the provision of the electronic health services in the country even. The other part which is important is the best use of the available resources that we need to closely monitor this issue. The issue is not really easy in terms of sustainability because with the countries depends on humanitarian funds actually have a problem whenever there is a conflict in two or three places all over the world. It is not like the issue of a few years ago. The issue was mainly focused on Syria. Now Syria and Palestine. Now Turkey. Again Ukraine. So all over the world there are certain emergencies that need the interference of the humanitarian donors or funders, I would say. So this actually causes a problem in maintaining the fund for the service. Thank you.
Thank you so much indeed. Now, very quick question that has come actually in the chat. I mean, in one word. Let me start with Dr. Zuhair. Is there any registration, civil registration issues that for new birth, for dead people, for deceased people, as part of digital health in Gaza?
Actually, this is usually done by the Ministry of Health. But you know, we build the profiles for the newborns based on the submission of the birth certificate. We do not initiate a profile making for any client without having a proper documents for registration to prove that whether he's dead or alive.
Excellent. Thank you so much. The other thing, Dr. Bashir, is the civil registration part of digital health in Syria?
Yes, indeed. Yes, indeed. I have highlighted this in my presentation. I mean, the WHO country office has supported the civil registration system that's linked to the MOH specifically, i.e. death and birth notification. And this, we have used the DHIS platform for that. So now I mean, the system is well utilized. The dilemma that we are facing is with regard to this is happening in the community, because the system so far is only covering hospital, and we'd like to link more with the Ministry of Interior just to have wider coverage on that. Over.
Excellent. Thank you very much indeed. Dr. Vajira, is the civil registration birth certificates and death, at least in Sri Lanka and in other Commonwealth countries, do you have any idea whether this is actually part of the digital health, or as has been suggested or has been in a number of other countries, independent of the health sort of between brackets sphere?
Yeah, even in Sri Lanka, it's independent of the health system. So I think civil registration, I cannot, you know, it's not an area that we have looked at broadly, but across the Commonwealth. But if you look at the historic, you know, structuring of the Commonwealth along the British lines, it would be, you know, registration would be outside of the health system. But the importance of, you know, data sharing, integration of systems has been highlighted. And so I guess these are at different stages of, you know, maturity in terms of implementation. So as you know, it's a tough area to.
Yeah, I do remember actually when I was in.
Especially with the, you know, especially when it comes to deaths, you know, when the births are happening in hospitals, that's fine. I think most of the deaths occur in the community, and then capturing that data becomes quite difficult. Mm-hmm.
Yes, indeed. What I was going to say, when I was in WHO headquarters, there was a department actually taking care of civil registration and trying to bring that back to the health sector, being responsible for that. But for the sake of the person who asked the question, there are a number of reports actually issued by WHO on the exact status of civil registration, the registration of birth and death of people. And the motto that was actually used, if you don't register the new birth, then the newborn babies, then you are less likely to include them in the healthcare system, which is really important to make sure that every single individual is being registered and taken care of in the healthcare system. Dr. Ghada, in UNRWA, do you register people in the digital health system or the e-health system, or it is actually in a number of other sort of registries?
In UNRWA, sorry. In UNRWA, we have a registration system for Palestine refugees. Palestine refugees are registered only in UNRWA. Of course, the birth certificate is issued by the country, the Ministry of Interior, or whoever is responsible from the government. But the people that we serve should be registered in the registration system of UNRWA. But not to leave anybody behind, newborn children are given the service upon the birth certificate that is issued by the government, just not to miss any immunization or whatever until they register in the relief and social services system. And by the way, we have a mobile app for the Palestine refugees now that they can send this birth certificate copy through the app to the registration people in UNRWA to register their children without even bothering themselves to go to the registration place.
Okay, thank you. Jordan, I'm not sure actually. Is it the Ministry of Health, Dr. Severio? Is it the Ministry of Health or Ministry of Interior who register people in Jordan? Are you aware?
I believe it's the Minister of Interior. I am not totally sure about that, but it should be the Minister of Interior, as many other, issue around the registration.
Okay, so it's like many other countries, divided between the health and the other ministries. In Iran, is it the Ministry of Health or Ministry of Interior, Ministry of other ministries, civil registration?
Ministry of Health. Yes.
In the Ministry of Health. Okay. Well, I think we have taken half an hour extra, which means actually that this has been very, very, very interesting. And in fact, I might make a demand that more of the webinars are being done, organized by Comstas, and more time is given to the speakers to say what they have seen, what they do in particular. My last thing is to provide, to say many thanks for Comstas, for Dr. Azima, and for Dr. Zakaria for inviting me to moderate this session. And important to also thank all the audience, all the speakers for their patience and for presenting the data that they are actually experiencing and the sharing the different knowledge that they have. So thank you very much indeed. The last thing is to ask Dr. Azima to say a few words of thanks if she wants.
I
Dr. Azima.
Take much of your time. Thank you, all the speakers. But before that, I have seen Muhammad Noor. He has raised his hand for quite long. A quick comment or question, whatever you want.
Yeah, Muhammad Noor.
Thank you very much, Dr. Najib, and thank you very much, Azim. Actually, I raised my hand for a long time. I had some questions, but it's
well, I'm really sorry, Muhammad. I cannot see.
That's fine.
The different people.
Fine. I understand that.
Question to one speaker.
Yeah, I think that there's no time now for questions, but I'm very much impressed with this very inspiring discussion. And Dr. Najib has asked lots of very relevant questions. My question was relevant to the scope of electronic health record. Is it in each of the country? But I don't think there's no time. There's time now for discussion. I'll try to maybe have this discussion in separate discussion with each of them. I'm just introducing myself. I'm Mohammed Noor. I'm the focal point for digital health and innovation in the regional office of Eastern Mediterranean. And I hope that we can have several discussions like this in the future. Thank you very much.
You can send the question to us and we can direct it to the speaker.
Yeah, I'll do that separately.
Advice,
Yes, thank you.
I have also seen your hand raised. You can also send your question via email. We don't have
Well,
much time.
I don't have any question. I just wanted to make suggestions that I've already put on the chat box, and maybe a future group, a core group can be formed out of this discussion today, and then they can sort of discuss further in their own groups so that we can formulate a strict policy in terms of the digital health, because there are no policies and regulations being implemented in terms of this area, and the lack of capacity building. And I also have suggested of formulation of a university in this regard and a center for health innovations where we can involve the digital health professionals in developing innovative approaches for taking digital health and improving the systems in healthcare delivery.
Thank you, Dr. Minhaj. Certainly your suggestions are well taken, and I think we can deliberate on it separately with you.
Thank you.
Thank you, Dr. Najib, for moderating this session. It has been a job well done. And the speakers bearing with us, keeping their time, giving us their time, and being punctual. Thank you all, the participants. And we'll be sharing with you presentations, the proceedings of this webinar stream. Thank you all.
Thank you. Thank you very much indeed.
Thank you. Very nice session.
Have a great
Take
day.
care. Allah
Pleasure.
Hafiz.
Thank you.
Thank you.
Thank you very much, colleagues. Thank you very much.
Thank you. Thank you.
Thank you. Thank you.
आप सेव करें चैट को बंद करने से पहले
Oh,
करें
what is it?
चैट